Chemotherapy and hazardous drug precautions. Treat all size spills the same. Clean up the spill as soon as possible. Spills should only be cleaned by trained personnel. Appropriate PPE for a chemo spill includes double gloves, a gown, respiratory and face protection, and shoe covers. To clean up a chemo spill, don PPE, contain the spill using plastic-backed absorbent sheets or spill pads. Evaluate the extent of the droplets by moving away from the spill and checking under patient beds, carts, and tables. Pick out any sharps with a scoop. Clean the area, starting with the least contaminated area and go to the most contaminated area. Discard all material used in a hazardous drug waste bag. Then you can doff your PPE, seal bag, and place in a hazardous waste container. Then wash your hands with soap and water. For hazardous drug safety, use appropriate PPE, which is double gloves, when handling any kind of bodily fluids or linens for at least 48 hours after the last dose of chemo or hazardous drug has been given to the patient. This is for any linens that may have gotten chemo or hazardous drugs spilled on them. There is this infested linen kit located in the central supply room right next to the chemo kits. You will place the soiled linen in a clear water-soluble bag, make sure it's tied, and then place the water-soluble bag in this purple bag. Make sure it is tied, then place the purple bag in with the other soiled linens. Make sure you don't place this bag in the linen chute. So in your supply room, the chemo spill kits are located right here. This is everything that's included in your chemo or hazardous drug spill kit. You have your disposable hazardous drug resistant gown with a back closure, your chemo splash goggles, a respirator mask, 2 pairs hazardous drug tested gloves, chemical resistant shoe covers, at least 2 sealable thick plastic hazardous drug waste disposal bags with an appropriate warning label, a caution sign that you can put out front, a card to fill out an exposure report, a disposable scoop for collecting any kind of glass fragments or sharps that may be in the spill, and absorbent plastic bag sheets or spill pads that'll help contain the spill. This is the hazardous drug precaution sign that should be hung on the door with the drug start date and the time. So after a patient goes to the bathroom in a hat or a urinal, pour the urine carefully. To avoid splashing when flushing, put the toilet lid down or cover it with a chucks if there is no lid. So in summary, protect yourself, wear appropriate PPE, cover the toilet so you're not being splashed with chemo bodily fluids. The chemo spill kit has everything you need to clean up a spill. Make sure you update door signage so we are properly handling these types of fluids, and also make sure to educate your CNAs too on these patients so they are not being exposed. Reach out to your charge or any chemo educators if you have any further questions. Thank you.